it's been 5 days since Florida implemented a full phase one reopening. It's one of the largest states to do so, but there are some concerns. So we want to bring in Marc Caputo. Marc, you are a reporter for Politico to talk a little bit more about how things are going in Florida. And here's the thing about Florida. The numbers actually have been pretty low in Florida, and the governor, DeSantis, has really been taking credit for that. Can we talk a little bit about, I guess, the policies or how they manage to keep their numbers low based on the numbers that they're reporting?
Well, we don't really know. We don't know a lot about the virus, and we kind of don't know a lot about the effectiveness of our response in different places. But one thing I think that should be pointed out, Florida's like 10th in deaths, but is third in population in the nation. And there's a lot of, let's just say, kind of bitterness from Governor DeSantis that national news media, especially those based in New York, spent a lot of time talking about, quote, Florida morons of speech, and not about, say, Governor Cuomo's nursing home policies or the fact that subways remained open and the infection rate and the death rate just went sky high in New York and didn't in Florida. So to your question, what did we do right in Florida? Well, one of the things that DeSantis did do is he deferred to local government. And local governments in South Florida, which is kind of the hotbed of infection, Miami-Dade, Broward, and Palm Beach County, they closed down kind of earlier, certainly before the governor called for stay-at-home order. And he was sort of dragged into a stay-at-home order statewide after deferring to local. Now, the bigger question is like, why did Florida, with the third biggest population and the 10th highest death rate from coronavirus, do so well, relatively speaking? I'm not saying it's great. It might be that we have warmer weather and the virus is harder to transmit in warm, humid weather. It might be the fact that we have sprawl and we don't have a lot of public transportation. And also cell phone mobility data showed that Floridians sheltered in place sometimes before their governments called for it. In the end, if you socially distance, it makes it almost impossible. Technically, if you're 100% socially distant, it makes it impossible to transmit the virus. I don't really think it's rocket science, but at the same time, we have a kind of three different stories emerging. One, Florida's coronavirus response and local governments. Two, what's happening with the unemployment system as a result of coronavirus response and social distancing. And then three, the governor and to a degree conservatives' bitterness with the national news media over the coverage of coronavirus in Florida versus that in New York.
Yeah, so Marc, DeSantis has been critical. He's criticized the press, taking a page out of his, out of President Trump's playbook, which is criticize the press because he believes that the press, the national press, has been paying too much attention to Governor Andrew Cuomo of New York and not giving him enough attention for all the things that he's done. However, let me point to a Miami Herald op-ed from a few weeks ago that says, stop hiding true COVID-19 stats, Governor DeSantis. Our lives are still at risk. So the governor is clear and transparent about the successes that he's had, but break down for us what some in local media in Florida are saying about the numbers he is not sharing.
One of the mystifying things about Governor DeSantis' response, again, when you look at the data, it doesn't look bad, is that he has done a bad job communicating it. And for some reason, he's decided in the case of coronavirus deaths, he tried to muzzle medical examiners from releasing that data. He just wanted to have kind of one data stream coming out of the state. He also wanted to keep nursing home information somewhat private. These local media organizations had to sue. So why the governor had to do this when things, again, relatively speaking, were going well in the state, I'm not quite sure.
Yeah, I think that's a pretty good observation because, before I really looked into the numbers in Florida, I sort of assumed that they were trending the same way that we were seeing in other states, other high population states. And then when I looked at the numbers, I thought, wait a minute, that's actually not that bad at all, with the exception of some key, areas. But then we get this reporting about Dr. Erica Jones, who claims that she was pressured to, change the numbers so that it would sort of bolster the argument for reopening. What do we know about that? Is there any validity to her claim? What's going on with that?
Well, I don't know if we should call her a doctor. I don't think she has a PhD. Her name is Rebecca Jones, okay. And she works at the Department of Health. The dispute, as far as we can tell, because she hasn't spoken to us, it concerned downloadable data on the state's well-heralded website, dashboard that has lots of data and lots of information. And there was a field there about infection date, and it had some self-reported data in there. And some people self-reported that they got sick or they got COVID in January. The reality is that self-reporting by a scientist or a doctor. Some news media organizations wrote stories about this, wondering if COVID infection was here at the time based on the self-reported data. Now, it appears that someone in the Department of Health decided to quote in the word of an email that comes from Jones to the press, wanted to keep the press from getting this information. So apparently this information, the downloadable data, was pulled from the website for 2 days over Jones's objection. And eventually she was at loggerheads with her bosses, and she was fired and or pressured to quit. This gets back to what I was talking about earlier about kind of dumb media management. In this case, again, if you look at the statistics, Florida is not looking so bad. Florida's response, relatively speaking, is not looking so bad. But the governor's response and the way his administration is trying to keep information that is not harmful to it out of the public view is kind of mystifying. There was a really great report in the Miami Herald the other day where it talked about one of the models that showed a lot of deaths in the future if Florida didn't lock down. The governor understandably criticized the news media for printing these doom and gloom numbers, these projections. But quietly and privately, the governor's administration was signing no-bid contracts, and understandably so, to be able to house people in case there were these widespread hospitalizations and deaths. So the governor's administration, on one hand, was paying attention to these models and thought they were important. On the other hand, it criticized the news media for printing it. Similarly, in late February, the administration appeared, according to the Miami Herald, which again had another good report on this, to be warning nursing homes, getting the state in position to be ready to lock down and respond to the virus. But at the same time, the governor wasn't communicating the same level of concern over the potential spread of the virus in late February publicly that he was privately. And that raises the question, why? Now, I live in Florida. I would like to have known in late February that this was happening. I think one of my close friends and neighbors would like to have known the same thing. She got coronavirus in March. Now, I'm not blaming the governor for that, but I'm just saying that knowledge is power. And unfortunately, some in government sometimes think that knowledge shared is knowledge lost, and power shared is power lost. And it's not. An informed electorate and informed citizenry is better. And I don't understand why the DeSantis administration doesn't just kind of just say, look at the numbers, we have good numbers. But at the same time, we don't need to shield this data from the news media when it's asking for it. It's not harmful to the administration's case or to the regular conducting of business in the state, or people just kind of living here and living well and healthy.
All right, Marc Caputo, thank you, my friend. Appreciate it.
Thank you.